Good morning all. My name is Madhura and I'm a PhD student in the Nanoscopy for Nanomedicine group at IBEC. Today I will be talking about peptide-based strategies for selective prostate cancer targeting. According to the survey of Globocan for 2020 by the World Health Organization, prostate cancer marked the highest incidence rate in males worldwide. A key bottleneck of current treatments is a lack of selective targeting. The systemic treatments in place such as chemo or radiotherapy are not all effective and result in undesirable side effects, which emphasizes the fact that one drug does not fit all in cancer, and there is a need for more targeted and targeted therapies as a mean for personalized and precision medicine. Nanocarriers have been exploited for anti-cancer treatment for a long time. However, a key problem that remains is still the delivery efficiency of actively targeted nanomaterials, which could be due to a multitude of biological factors, thereby calling attention to a thorough study of nanoparticle design parameters for an optimal design for selective targeting. With this framework, we design a prostate cancer model using two cell targeting peptides, the WQP, which has a moderate to low affinity for PSMA, a known prostate cancer biomarker, and GE11 peptide, which has a high affinity for EGFR, which is a known metastatic prostate cancer biomarker, with the rationale of achieving super selective targeting of prostate cancer cells by the virtue of cooperative effect of the affinity and avidity of the chosen peptides, which would then result in formulation of dual nanoparticles having both peptides in specific stoichiometric ratios in order to achieve selective prostate cancer targeting. The objective of my talk today would focus on effective GE11 affinity and exploring the WQP avidity. For effective GE11 affinity, we employed two strategies for conjugation, the pre and post conjugation strategies. As the name suggests, pre-conjugation involves conjugation of the peptide to the polymer prior to the nanoparticle formulation, whereas the post-conjugation strategy employs conjugation of the peptide after the formulation of nanoparticles. We see that there is a twofold increase in the surface density of GE11 on the nanoparticle surface from the pre-conjugation strategy. Further, for cellular uptake studies, we see that there is an increasing trend in the specific and selective cellular uptake of pre-conjugated nanoparticles over the post-conjugated one, thus rendering this as a preferred strategy for further studies. For exploring the WQP avidity, we formulate multivalent WQP nanoparticles along with the monomeric peptide, and we study the effect on cellular uptake. We see a clear increasing trend in specific and selective uptake of multivalent WQP nanoparticles over the monomeric peptide form, which could be attributed to the combined avidity effect that enhances the selectivity of the peptide for the target receptor. To summarize, the properties of surface ligands play a very important role in defining the targeting potential of a nanosystem. Pre-conjugation strategy works better for obtaining a higher and more controlled ligand density on the nanoparticle surface, and avidity, or the combined strength of individual ligands, in this case the multivalency, increases the overall affinity of the weak binding ligand and improves its selectivity, which is a crucial aspect for achieving super selective tumor targeting. For further questions, please refer to poster number 14, and thank you for your attention.